Welcome to the first Ardenwood Presents webinar of 2024. I'm John Mitchell, and I serve as Executive Director and CEO for Ardenwood here in San Francisco. Our webinars are designed to inspire and inform all of us about important topics. We're glad you're joining us today. In fact, we invite you to join us in other ways too. If you're in the area, please come for lunch or dinner. Our food is fabulous. We also welcome overnight guests. We have lovely, large, well-appointed rooms. There's a well-stocked Bible research library and a metaphysical study room that's open 24/7. You have easy access to local shops and restaurants around the corner on West Portal Avenue, and the ocean is just 2 miles that way. Public transportation is steps away and takes you into the city. Museums are nearby, and the magnificent Botticelli exhibit is at the Legion of Honor until February 11th. It's fabulous, actually. You and your family are welcome to stay with us, or you could meet a friend here whom you've been meaning to connect with. And by the way, speaking from a native Minnesotan, February is a wonderful month here in San Francisco. The rains let up for about 4 weeks. The flowers are just coming into bloom before the rain starts again in March. Anyway, it's a great time to come. We hope you will. Now, as a 501c3 charitable nonprofit organization, Ardenwood supports the Ministry of Christian Science Nursing and the expectation of healing. We provide skilled Christian Science nursing care. We offer Christian Science nurses education and training, and we present online events like this one. And your financial support of our programs and services is essential, and we're thankful for each and every donation, truly. As you know, today we're focusing on Medicare for Christian Scientists. Our presenters, Jim, Katie, and Nancy, will provide an update on Medicare plans that best serve Christian Scientists, and then we'll answer your questions. Ardenwood is a designated religious non-medical healthcare institution in the law, and it's also called a RINKI for short. Now, as a religious non-medical healthcare institution, or RINKI, Ardenwood is a Medicare Part A provider. One misperception of Medicare is that it wants too much information about your physical well-being. Well, as you know, Christian Science nurses do not diagnose, so we report only general information to Medicare. As the payor, Medicare wants to ensure that the care received should be covered. In other words, your care needs must require a hospital setting if you weren't at Ardenwood or another RINKI facility. Actually, we have found that Medicare is much less intrusive than most insurance companies. And let me explain an important topic, or an important point here. Medicare does not in any way affect the care you receive. It simply is coverage that is simply a way to pay for the cost of your care. I also want to emphasize the wisdom of having a care plan and of sharing it with your family or designees. If you have a need to go to a Christian Science care facility like Ardenwood, you want your focus to be on God and healing, not on how to pay for your care. Thinking through your options in advance at this time is a support to healing. It's also a support to those who love and care for you. One last point, Medicare is also very helpful if for any reason you find yourself in a care setting that's not your first choice. Finally, the content shared is only informational and is not intended to be legal advice. A replay of this webinar will be available on our website, ardenwood.org, in the next day or so. Replays of all of our webinars are also on our website. As a reminder, you can ask questions using the Q&A button at the bottom of your Zoom screen. Now, let me introduce our presenters today. Jim Maher is a certified senior advisor and a broker consultant specializing in Medicare. He is also a certified long-term care insurance strategist. Jim has talked to literally thousands of Christian Scientists since we had our first webinar, answering innumerable questions about Medicare, long-term care insurance, and estate planning. He's been a tremendous blessing to our field. And from what he's told me, he's loved meeting and working with all of you. Katie Burris is a Medicare specialist and certified long-term care consultant, helping individuals with their Medicare and long-term care planning strategies. Katie is a partner at McGrew and Maher Insurance Services and has been in the business for nearly 20 years. She is licensed for life insurance, long-term care, and Medicare in several states. Nancy Sedan is our finance director here at Arden, and through her work with us, she has gained many years of experience with Medicare and other healthcare insurance policies. So let's get started. Jim, Katie, and Nancy, it's all yours.
Hey, fantastic. Thank you, John, for the nice introduction. Hi, everybody. Jim and Katie here, and we're excited, right, to bring you some of the new 2024 updates, and we've really geared it for Christian Scientists. And John's right. Gee, the past couple of years, I know we've talked to thousands now. It's amazing, and we love doing it, and we love helping you. You help educate us, too, about Christian Scientists, so we appreciate that. So first off, I'll tell you just some of the basics about myself. I've been doing this 34 years. As John said, I'm a certified senior advisor, long-term care consultant, Medicare strategist, and Katie, I'll let you kind of tell about yourself too.
I'm a Medicare specialist, certified long-term care consultant, and we're broker consultants who specialize in Medicare and long-term care. We're not affiliated with CMS, Medicare, or any other government agency, and really our job is to just help mitigate healthcare costs in retirement or when you're over 65. Today, we're going to talk about two things that are happening right now that are really important. And when we're talking to Christian Scientists, we find this comes up a lot. The first one being the general enrollment period. So if you just have Medicare Part A and you don't have Part B, now is the time of year. We're right in the middle of it where you can add Part B. We're going to go over that. And the next one being the Medicare Advantage open enrollment period. So if you have the HMO type plans and you don't want that anymore, now is the time of year where you can get rid of that and go back to original Medicare. We'll talk about how and why you'd want to do that.
Right, and that's super important today. I mean, we're going to emphasize that over and over. Now is the time, because we talk to a lot of you and you have those plans and they're not great for Christian Scientists. If your goal is to have spiritual healing, for example, at Arden, a Medicare Advantage plan is not good for you, and it's not good for Arden.
So we're going to talk about Medicare, the basics, two parts. So original Medicare is what you get through the government, that red, white, and blue card. The first part is Part A, and that is the hospital or the RINKI, the religious non-medical healthcare institution side of Medicare. And then Part B is the medical insurance side. And to get those, you go through the government, and there's 3 specific times you can pick up Part A and Part B. The first one being when you turn 65. You can do it the month of, 3 months before, or 3 months after your 65th birthday. The second time we see is the special enrollment period. So when you're coming off a group plan, you've been on a group plan with 20 or more employees, it's time to retire. Maybe you're 70, it's time to retire. Now you can add Medicare Part A and Part B at that time. And the very last time, if you didn't do either of the other 2 periods, is the general enrollment period, and that's what's happening now.
And now's the time to add Part B. You just can't randomly say, gee, I have had Part A for 3 or 4 years now, and I'm going to add B, and it's June or July or August. You can't do that. You have to wait until this time frame. So I'm talking to a lot of Christian Scientists out there who I've talked to, and now is the time to add Part B, right? And the confusing part about all this, I always think, is there are no Medicare offices. If they just had Medicare offices, that would make it really easy, but they don't. You enroll through Social Security, even though you're not applying for Social Security, but you're going through Social Security to enroll for Part B. So it's simple. And right now, if you're going to, you can apply now and it'll be effective in February. You do it in February, effective March 1. It's always the first of the month, right? So, and here's the thing too, we're going to talk about late enrollment penalties. If you haven't had Part B since you've been 65 and you're 67 now, you're probably going to be subject to a penalty. And the penalties are unforgiving. The government does not forgive. And it's real simple. It's 10% of the Part B premium, which is $174.70. So 10% of that for every 12-month period that you should have had Part B and didn't. So that's why we're really encouraging everyone, even if you're thinking you don't want the insurance side or anything, that's absolutely fine. But to have Part B, that's important. Plus, you don't have to pay that fine. You don't want to go 3, 4, or 5 years. We've seen 100% fine, which is 10 years, and you don't want that to happen to you. After that, if you decide, then we can talk about supplemental coverage. But right now, we really want to emphasize adding Part B if you don't have it.
The other thing happening right now is that Medicare Advantage open enrollment period. So we're getting calls every single week right now where people are wondering, I think I have one of those HMO type plans that you talked about. So when you're looking at the ID card, when it has something on it that says HMO, or you can see that it has on the right-hand side, it says Medicare RX, those are Medicare Advantage plans. They're PPOs, they're HMOs, and they're really not friendly to use at a rinky because they want for you to stay within their network of providers. They're supposed to let you go to a rinky. They just really don't a lot of times.
There are no rinkies that are on an HMO list that I'm aware of, right, Nancy? I've never seen any out there.
Correct.
Yeah. So it's the time, and a lot of you, here's the way I look at Medicare. It's very confusing, right? It's just it's called job security for us, by the way, but people don't understand it. And a lot of times you see all these ads on TV and you get all these calls and you're thinking, well, if I get something, it's better than nothing. And gee, they have these plans, these HMO plans hardly cost anything, 0 premium or $19 a month. And you go, well, that's fantastic. But they never ask about you being a Christian Scientist and how it's not appropriate for you to have these plans if your ultimate goal is to receive care at Arden Wood or another Christian Science facility. So now is the time, and we've talked to a lot of you out there, you can leave these plans right now during this Medicare Advantage open enrollment period.
The other thing too is it includes a prescription drug plan, even though you don't want the prescription drug coverage. And if you didn't have prescription drug coverage from the time that you were first eligible for Medicare, then you could pay a penalty for having that Medicare Advantage plan because it has that prescription drug benefit.
Right. That's another, I'm sorry, I didn't mean to cut you off, but we get that all the time. They say, well, this plan's supposed to be 0 premium, but I'm paying $34 a month. Why is that? That's because if you didn't sign up for Medicare Part D when you turned 65 or first eligible for Medicare, they're fining you. So even though the plan may be 0, right? In this example, that the H company there is 0 premium plan, but the fine every month is $34. So the good news is if you drop that plan that you're on, that $34 a month penalty in that example goes away. So it goes away. So that's why we're going to encourage people, take a look what you have now, pull the card out of your wallet, that's where it is. And like Katie said, if you have any initials on their HMO, PPO, RX, that's a Medicare Advantage plan.
The other thing too is when you have these Medicare Advantage plans, some of them, really frequently the HMO plans, want for you to be assigned to a doctor. You don't see a doctor, but they assign you to one. And you're not going and seeing a doctor. And so what happens is a lot of times the doctor's practice will drop you because you haven't been and seen them, and they're worried about the liability of that. So what they do is they say, okay, listen, we're dropping you as a patient. And then if you needed any sort of care, even if you need to go to a rinky and you don't have a doctor assigned, the insurance company says, well, you have to go through that primary care doctor first to get any sort of approval on anything.
Right. Very true. That's a really good point.
So with a Medicare Advantage plan, Jim mentioned that you can drop that Medicare Advantage plan, and if you have that prescription drug penalty, it goes away. So you can go from your Medicare Advantage plan to original Medicare. And then also, if you wanted to get a supplement plan, you could at that time.
Right. But now is the time, January 1st through March 31st. This is the time to do that. You can't just randomly decide to drop it.
So why do you have Medicare? What does it cover? So Part A, the hospital or the Rinky side, they cover Christian scientists in a Rinky as long as it's a Medicare approved stay. Nancy, will you talk about that?
Sure, be happy to. For someone to come to Arden Wood and be covered by Medicare, their care need would have to qualify, which is what Katie just said. And those qualifications would be that the care need would need to be something that perhaps if you weren't a Christian Scientist, you would be going to a hospital to have taken care of. It would need to be something that cannot be cared for at home. You would need a skilled Christian Science nurse to take care of that particular need. And it would need to be under a care need that qualifies for a Christian Science journal listed nurse to make sure that your care is properly being provided. So those are some of the criteria. So not every single care need fits that qualification. And so if it does, then it's covered by Medicare here at Rinky. But if it doesn't, then it would be private pay.
Thank you. So Part A is premium free. Premium free, you simply pre-funded it. So if you or your spouse worked and paid taxes for 10 years or longer, you don't have to pay premiums to have Part A. And the coverage is nationwide. So anywhere in the entire US, including its territories, any hospital provider or Rinky that takes Medicare. So with Part A, when we're looking at the costs of that, if you needed to stay in a hospital or stay in a Rinky for a Medicare stay, the deductible for the first 60 days this year would be $1,632. And starting on day 61, there would be a cost of $408 per day, assuming that you're still in the hospital or the Rinky at that time. And then day 91 would now be $816 a day.
And those are the lifetime reserve days too. That's kind of the lifetime reserve days, and you can only use those once, but you might as well use them if you have them. It's better than paying out of pocket for them. So again, that's just original Medicare. That's with no type of insurance plan whatsoever, just straight original Medicare.
So this deductible and the per day costs are based on what Medicare calls a benefit period, meaning you've been in and you've received care and you've come out and you haven't needed any inpatient care for at least 60 days. So that deductible is not like a one time a year or one time a lifetime thing. That could happen multiple times in a year. That's
a really good point, because people see the deductible and you think, well, it's a calendar year, and it's not. It's per occurrence, right? So that's important.
So when we look at what the cost would be for an extended stay, you have the deductible, and then the per day cost from day 61 through 90 would be an additional $12,240. And if you're still in a Rinky and you need cares from day 91 through 150, that would be an additional $48,960. So the total cost for 150 days would be over $60,000.
Right. And I know there's the National Fund, Nancy, and there's other ways it can help a Christian Scientist. But we just want people to understand, if without that, this is what you'd be facing if you were in for a longer stay.
So Part B is the medical side, and you do pay a premium for Part B. It's adjusted for income. So when we're looking at the premiums for 2024, Social Security is pulling your 2022 tax return, and your monthly premiums would be anywhere between $174.70 and $594.
Right. And what they do is they look at your modified adjusted gross income on your tax return. So like Katie said, every year they're doing a 2-year look back. So for 2024, they're going to look at your 2022 return. In 2025, they're going to look at your 2023 tax return, et cetera. So they're automatically going to pull that. And this year, if you're an individual and your modified adjusted gross income was more than $103,000 in 2022, they're going to charge you a surtax. So you're going to pay more than that $174.70. And we have that, I think we have it on here, and we can also email that to you. So if you need to have that schedule, we have it for you.
And same thing with Part A. Part B is also nationwide. Any provider that takes Medicare, you can see. We talked about that premium penalty. So that late enrollment, for every 12 months that you should have had Part B and didn't, that $174.70, that's where they charge that additional 10% to.
And unfortunately, those penalties last forever. The government's very unforgiving, so we don't want that to happen to you. So we want to make sure that if you haven't had Part B, now's the time to enroll for Part B. And if you're turning 65, we really highly recommend that you do get Part B, right? So that you're not in a penalty situation. And again, we've seen some Christian Scientists that haven't had it and they didn't know they should have had it. And now that they're getting it, some are 5 years. Well, that's another 50% penalty. 10 years is 100% penalty. And that's a lot. And we don't want that to happen.
So when we just say Part B medical insurance, here's the things that are covered under Part B. In red are the items that are most frequently used by Christian Scientists. So in case something happens where you're unconscious in public and someone calls 911, that's where an ambulance or an emergency room may come in. Or if you need a bone set, an x-ray, an office visit, something like that may kick in.
That's all covered under Part B. That's the medical side. For non-Christian Scientists, the doctor side, that's everything else that's not covered under Part A is covered under Part B.
So with the medical insurance side, in 2024, there's a $240 deductible. And then after the $240 deductible, you are responsible for 20%. But there's not a cap on that. So it's not like if you got a $10,000 bill and they came back and they said, okay, you paid $2,000, guess what, you're done. After that, no more, 20%, you paid $2,000, you're done. That 20% continues for the rest of the calendar year and then resets next year.
Exactly. There is no cap. So most people that have been on, we call them under 65 plans, on your employer's group plan or a spouse's group plan, you always have what's called the maximum out of pocket. And normally it's anywhere between $4,000 to $6,000, $7,000, meaning that's the most you can spend. Katie's exactly right. Real life example, you have a spill somewhere or you pass out, they take you by ambulance to the emergency room because they don't know you're a Christian Scientist, right? Then they're going to automatically do that. And you wake up, well, that ambulance ride is not cheap. I've seen ambulance rides billed anywhere from $2,400 to $5,000 to $7,000, even for a couple miles. So you would be on the hook, right, to pay that first $240 and then 20% of that ride. And then once you go in the emergency room, it's crazy now. I mean, these emergency rooms, the amounts they're charging are astronomical, and you're still going to pay 20% of that. And again, there's no cap. It's not like your group plan where you go, gee, I hit $5,000, I'm done for the entire year. Like Katie said, that's not how it works. If you had another emergency later in the year, you're still on the hook for that 20%, and again, no cap. So we want to make sure that we offer you some options to show you how to take care of that using supplemental coverage.
We want to remind you that Medicare doesn't cover everything. So when you have Medicare Part A and Part B, it doesn't cover all the cost of your care. So we talked about you have that 20% and you have the costs in the hospital. It doesn't cover prescription drugs. The question that we get most frequently, it does not cover dental, vision, or hearing. So it doesn't cover eyeglasses or contacts, hearing aids, stuff like that. And then also the other question we get most frequently is it does not cover long-term care, so custodial type care, and it does not cover any care received outside of the United States.
And who we usually get those calls from, by the way, are adult children, are the ones calling us. And we've been getting more and more lately too on how am I supposed to pay for this? Mom now. And well, Christian Scientists and non-Christian Scientists, but the adult children are involved because they're taking care of you because they love you, right? And they're going to take care of you. And they're wondering, who's paying for this? Is that Medicare or Medicaid thing paying for that? And a lot of times we have to tell them, no, you have to write a check, right? Unfortunately. So it's a huge surprise to adult children who are taking care of parents, and that happens.
So we keep mentioning that supplemental coverage. So once you have Medicare A and B, then you can have an insurance coverage on top of that. And we talk about the Medicare supplement plan. Separately would be the prescription drug plan, but that is an individual decision. Right. Most Christian Scientists don't purchase that portion. We just make sure that everybody understands that if you don't do it, you're going to be fined, but hopefully you will never need prescription drugs, we hope. And I'm sure you hope as a Christian Scientist that won't happen either. But we just want to make sure that people are aware of that. But these Medigap's another word for Medicare supplements. Listen, from doing this for a long, long time, they don't make it easy, right? They can't just say, we're only going to call it Medicare supplements. No, they got to be Medigap insurance, but they're interchangeable terms. It means the same thing. These plans are designed to pick up all the deductibles or most deductibles, co-pays, or co-insurance that Medicare doesn't cover. And we're going to talk about some popular plans today, one that I have actually. But again, it's going to supplement Part A and B of Medicare. And these are private insurance companies, and it's going to help limit your out-of-pocket costs. And the same if you have a stay, right, a spiritual stay in a rinky. But to have that, you've got to have both Parts A and B of Medicare. That's really important because a lot of you have Part A and you don't have Part B. So the big quiz is you can add it right now, right, Katie, during this? You can add Part A and Part B, yes. Or if you only have Part A and you want to add Part B,
that's when you're going to add Part B, correct? Mm-hmm. Yes.
It's nationwide coverage and there's no provider network. So as long as you talk to Arden Wood or a hospital or a doctor and ask them if they take Medicare, as long as they take Medicare, you can see them with Medicare and the supplement.
And that's really an important point, especially to non-Christian Scientists. So if you've got a spouse that's a non-Christian Scientist, they're used to going to a hospital that's on a list where it's HMO or PPO. This is better than that because there are no lists. I can't think, I was trying to think of hospitals that don't take this in the United States, and the only ones I can come up with are VA hospitals. Right? I can't think of a hospital out there that does not take Medicare. It's hard to find one that doesn't.
So Medicare supplement plans go by letters, which makes this whole thing really confusing.
They used to be A through N, and they've taken out E, J, H, I. I mean, they've taken all these plans out. But the good news is that we're going to make this simple for you. Katie's going to pop up this star here on Plan G. This is the actual plan that I have. And I love Plan G because it's simple. All our lives, right, we work hard and we get to this point where we go to Medicare. And I want things to be simple and easy as I age. I don't want to worry about how many moving parts do I have on this plan. With Plan G, it's so simple. You see those 100% marks, you see them in every one but one square. So if I were to have a spiritual stay at Arden Wood on that under Part A, I'm covered in full, Katie. There is no copay or deductible. I don't pay a dime. It makes it so easy. Plan G, the only box there that's not filled in 100% is the Part B deductible. So I'm on the hook for the first $240 this year. That's it, quite honestly. And as a non-Christian Scientist, if I see a provider or have to go in for any type of voluntary surgery, I know that I'm going to be limited to $240. That is my maximum out of pocket this year on any Medicare approved expense. If you think about that compared to your group plan, where you may be out of pocket up to $5,000 or $7,000, right? Your maximum out of pocket. On Plan G, it's $240. And the plans are incredibly reasonable too for what you get.
That stay at the Ringy is covered at 100% as long as it's a Medicare approved stay. I'm sure Nancy wants me to make sure to mention that. So with Medicare Part A, if you have that supplement Plan G, then you would pay $0 for up to 365 days. Again, as long as it's a Medicare approved stay. So that's where that supplement kicks in.
I love that slide. Can we go reverse? Because I think that's really cool. Okay, you see all those expenses with the supplement. If you're in on a Part A stay, okay, now watch. They're going to go away with the supplement. You pay $0. It's a fantastic plan. It's peace of mind, not only for you, but for loved ones, for your spouse, or your adult children, knowing that you're going to be taken care of. Right? And that's your out of pocket. It protects families' assets. It does everything. It just makes sense to do it.
And may I just intercept for just 1 second? Sometimes the idea of out of pocket versus premium is not something Christian Scientists are as familiar with. So when we say there's no cost, it's true that there's no out of pocket cost, but you are still going to be paying a premium every month for this supplemental policy and a premium for Part B. So those two are costs, but
absolutely
they're fixed and they're small. Just want to be clear about that. But it is, in terms of a larger financial risk, it is definitely a vehicle that helps cap that risk.
Yes, thank you for that.
Yeah, I appreciate that, Nancy. So then on the medical side, so this is Part B when you just have A and B and you don't have insurance. You have that deductible, that $240 deductible, meaning what you have to pay before the insurance kicks in. And then after the deductible, that 20%. When you add Medicare Supplement Plan G, that 20% goes away. So Jim has mentioned you have $240 out of pocket. That's if you need to use Part B. And that's if you have that supplement plan because it takes away the 20%.
That is a huge deal. Let me tell you, that is a big deal. If you're going into an emergency room or an ambulance ride and you know you've got that and your worst case scenario is $240, that's incredible peace of mind for you. And like Nancy says, maybe the only reason we don't talk about the cost for the particular supplemental plans is because normally they're based on age and depending on what state you're living in. But just to give you an idea, I'm going to use a California number. So if I was turning 65 for supplemental Plan G in this area, in the Sacramento region and in San Francisco area also, you're about $140 a month for a plan like that. It's more expensive as you age. And if you live in other states that have maybe guaranteed issue like Massachusetts, New York, different states like that, it's going to be much higher, right? They have continual guaranteed issue periods. But it's really easy, and that's our job, is to show you these plans and what the cost is, and then you've really got to think about it and pray about it and decide if that's what you want to do.
So the last part of Medicare is the prescription drug side. So it helps cover the cost of prescription drugs, and it's optional to have the coverage. If you add a policy later, you may be subject to a penalty. And there's two ways in order to get the coverage. You can either buy it individually if you have original Medicare and a supplement, or when we talk about those HMO type plans, they include the prescription drug coverage.
And that's where when we're talking to you out there and you're saying, well, that's that Advantage plan that Joe Namath was advertising on TV, it's a $0 premium plan. Why am I paying $34 a month? It's because of that penalty, because you have not had a Part D prescription drug plan. And when you're buying that plan, even though the premium is $0 every month, behind the scenes, Medicare is saying, no, you haven't had that, so you're going to incur that penalty. So the nice thing, this is the time, if you want to get rid of that penalty, you can do that by going back to original Medicare. Once that Advantage plan goes away, so does that Part D penalty.
So We're just gonna go over the penalties again, so on those. So Medicare Part A does not have a penalty because it's premium free unless you didn't work for the 10 years. In that case, there would be a penalty. On Part B, if you're over 65 and you've been on that group plan and you're coming off, there's not a penalty. But if you are maybe 67, 68, and you should have been on Part B because you were not working after 65, you would pay 10% for every 12 months that you didn't have Part B. And then on the prescription drug coverage, if you don't pick it up, you don't have a penalty.
Right.
But if you have it and you've gone more than 63 days without prescription drug coverage, then they do charge 35 cents per month for every month you don't have the plan. And they just add that onto the monthly premium.
Right. And so what we see, just to back up a step here too. So most people that after 65, or at least by 70, you're taking Social Security, receiving Social Security benefits. Remember, that can start as early as 62, and you can turn that on kind of whenever you want, whenever it's advantageous to you. Once you reach 65, though, and you turn on Social Security, you're required to have Part A of Medicare, just so you know that. People go, well, I have Medicare and I never signed up. Well, once you start receiving Social Security benefits after 65, it's automatically required. They're going to send you the Medicare card with both Part A and B on there. Doesn't mean you have to take B, right? You may say, I don't want Part B. I'm still working. I'm still active, so I'm not going to take Part B, but you will have Part A. That's why this time frame right now, most people out there are just going to be simply adding Part B as in boy.
So,
next, okay, this is hard because we talk about long-term care. Hopefully, this never happens to anybody, but as we age, right, and we age, things do happen out there. So I always tell people long-term care, it's really not a place or a condition. It really is a life-changing event. By life-changing event, not only for you, but for your loved ones, your family, who's going to provide care for you because they love you. That's what adult children do. That's what grandchildren do. Even though you may not want them to, they're going to do that. And the last slide before we go back for a second here, I just want people to understand, in a non-Christian Science facility, Medicare does not cover long-term care stays. Nancy, maybe this is a good time because we get that question a lot. What if if I have some type of stay at Arden Wood? How does that work on the billing side for Medicare and long-term care?
For just a long-term care type of a need? Or
Right. So if they come in under that, right, because it can be billed under Medicare, can it be, it's both under Part A there?
Again, it depends on the care need, but if it's covered, it can be covered under Part A if that care need qualifies. And if there's a problem that doesn't yield immediately, it would go under private billing.
Okay.
We would provide care on a regular basis and be supporting of that healing. We're always expecting healing. There's never anything that is permanent or long-term, has to be accepted. During that time that healing's being sought, it could be paid for by the family, by yourself, by your resources, or there could be financial assistance available through the National Fund for Christian Science Nursing, if indeed your assets are not such that there's a true need.
Great. Thank you for clarifying that too. So when I'm talking normally about whether it's maybe a non-Christian Scientist or a spouse that's not a Christian Scientist, I've seen that out there too. There's normally three ways. I always tell people there's three ways to pay for care. You're going to use self-fund and use your money first. And it doesn't matter if you have assets set aside in a CD or a savings bond, or if you have to use IRA money, but normally that's what you're going to use first. In California, if you don't have the means and you spend down assets, right, you don't have a lot of money, people go into Medi-Cal. There's nothing wrong with that, but it really does take away all your options. In other states, it's Medicaid. Third option is to have some type of an insurance policy. And right now, not too many people want, if I say raise your hand, you want to go out and buy a long-term care policy. It's like, well, listen, I already have auto insurance and homeowners insurance, and I've paid 30 or 40 years on those, and I've never had a claim. So why would I want to take out a policy like that? So today it's just a real simple 2 slides on showing that there are other options out there. There's ways to buy long-term care now, and they're using life insurance. And the reason you use life insurance is you're going to get some type of a benefit back. Most of the policies have a rider. Rider is an enhancement to the base policy. So if I have a life insurance policy with a long-term care rider on there, I can kind of kill 2 birds with 1 stone, actually. Why? If I live and need care, that money I put in the policy can come back in terms of 3, 4, or 5 times more, right, than what I put in there to receive for long-term care. A basic example, and I hate to use numbers, but you kind of have to here, $100,000, if I put that into a policy over 1 year, 5 years, 10 years, or the rest of my life, however I get that money in there, and I need care 15, 20 years from now, that money's probably going to be $300,000, $400,000, $500,000 for long-term care. So I know I'm going to get a tax-free long-term care benefit, but you go, well, what are the other options? What if I don't want it anymore and I want to cash it in? These plans now have cash value built up in the policies. It's contractual, right? There's going to be a cash value buildup. Or if you decide to cash in, you can get most. It used to be some states you could get all your money back, but at least you're going to get some money back. The big thing, though, is the other purpose to life insurance, right, is if I never use the plan, I'm going to receive, if I pass away, my beneficiaries are going to receive a tax-free death benefit. So that's why I really like these plans. Katie and myself have helped quite a few people with them over the years. You're going to receive a benefit, a tax-free benefit, one way or the other. And it's so much better than buying the old type plans where you're putting money in and you're having massive rate increases from these insurance companies, and you have to decide, do I pay it into it 20 or 30 years? Should I keep paying on it? It keeps going up. With a life insurance policy, these premiums going in, right, they're guaranteed, and they're guaranteed to never have any rate increases. So it's another way to look at it. And we've talked to many people out there, many Christian Scientists, about how you can achieve tax-free benefits out there for care if needed.
So the most important thing that you need to know, you do not have to remember everything that we talked about today. If you have questions or need help, you can call or email either Jim or myself, and we'd be happy to help. We don't ever charge you to work with us or to do a call with us or to answer any questions. The insurance companies pay us to help you. You can always go to our website, and then at the end of the presentation, I know our contact information is going to appear, including our phone number and email addresses as well.
Right, and our email addresses will appear. And I have to apologize because last time we did the presentation, we had an overwhelming response, and we were trying to get back to people as quickly as possible, but literally we were receiving hundreds of calls and emails within a short time frame. So we do our best. And if we get behind, though, we normally always get to them. So our apologies, right, last time, because I know we got overwhelmed with so many responses. With that being said, that's kind of the what we had to present tonight. Again, the key points were, right, general enrollment period. So if you're going to add Part B, now is the time to do that. And if you're on one of those HMO type plans, the Joe Namath commercials on TV, now is the time if you want to get off those plans and go back to original Medicare. If your ultimate goal is to receive spiritual healing at a religious non-medical healthcare institution like Arden would or any of the Rinkies throughout the United States, then it's going to be much better for you to have original Medicare than it is to be on a Medicare Advantage or Part C type plan.
And maybe I can just elaborate a little bit about why that statement has come up. Why is it perhaps better to be on original than an Advantage plan for a Christian Scientist? Well, let's start with saying that the Advantage plan is required by law to offer all the benefits that Part A and Part B cover. So they should easily cover a Rinky because it's under Part A. But most of the Advantage plans have never heard of a religious non-medical healthcare institution. They don't understand the fact what it is, and when care is needed, if one is in an Advantage plan, as Jim mentioned, the there is a requirement on most of the plans to go through the primary care provider to access the benefit. And of course, you haven't seen a doctor. You don't know who that primary care provider is, and you don't want to go through that in order to come to Ardenwood and have our care here, Christian Science Nursing. What ends up happening is you make the call to come here, and then we have to work with you and your plan to help them understand what kind of a care need you have, and why you want religious non-medical healthcare institution care, Christian Science Nursing. And this can sometimes be quite an educational process. And sometimes your plan will also require pre-authorization, which means your Advantage plan has to actually approve you coming. And according to law, you do not have to have that, but the plans are all set. They've got their rules and their laws and their regulations, and so sometimes it becomes a bit of a challenge right at the beginning when you're trying to come and receive that care and just get on your way to a wonderful healing. So, and then also we do have issues on when your care, when we go to bill for your care. Again, the same thing happens. The plan has no idea who we are or why they should be paying us. So for those reasons, original Medicare is preferable because you don't have none of that interference that an Advantage plan might insert. If you have original Medicare Part A, and that's the only thing you need to be here at a Rinky, if you have that, it's easy peasy. You come on in, if your care need qualifies, then Medicare will cover. As Jim and Katie said, $1,600 is the only thing you're going to pay for 60 days of the initial part if you needed to even stay that long. So, and when we bill, it's automatic. They know who we are, and everything happens very smoothly. So that's why we like to at least let you know about this difference. There may be cases where an Advantage plan works for a particular family for different reasons. But this is something that a lot of Christian Scientists are just not aware of. And so we want to try to help you have the information you need to make the right decision for you. I think that covers the things I wanted to
that was
mention.
very good, Nancy. Very good.
Yeah.
So I guess do we have some questions, John?
We have some questions, Jim. But
Okay.
I thought maybe it's time for a quick commercial break.
Hey. Okay,
Nancy?
hey John, can you tell me how about the Niners and the Packers this week?
Oh my God!
Since we represent San Francisco,
Absolutely.
go Niners.
Go
Brought to you by
Niners.
Arden.
Look at the color I'm wearing. Yeah.
There we
There
go.
we go. We are so excited.
We would show you all the 49er here in the office, but we weren't sure. So, okay.
Well, Nancy, I was wondering if you could take 1 minute before we get into questions and say why it's so important to have an advanced healthcare director or an AHCD and where they can find it.
Certainly. An advanced healthcare directive is a legal document that enables you to be clear about what your wishes are in terms of your care needs. Should you be unable to make that distinction by yourself. And it is something where you can have a wonderful discussion with your family ahead of time as to if there's a need. I would like to go to a Christian Science nursing facility for my care. That might be the kind of thing you're interested in making sure they understand. And there are lots of specifics that the document allows you to clarify. And this document then also is helpful to have available to your loved ones, to maybe the local Christian Science visiting nurse service, if that's your choice, so that if there was a care need that you weren't expecting, this document is available to those who can help you. So for instance, if you ended up you woke up in a hospital and you didn't realize that there was a care need, this document can help the folks that care for you be able to take care of your wishes, which might be to leave the hospital and come to a Christian Science nursing facility. And we do have instances where this has been so helpful. So it's something that you can find on our website. We do have a template there at ardenwood.org. If you scroll to the very bottom of our homepage, you'll see health documents down below as a link. And you can find that. And again, it's a template. Has lots of wonderful ideas. And if you live in California, it is based on California law. And so take a look at that, and it is a excellent additional document to have for your care plan.
Thank you, Nancy. And I can't underscore enough how important it is to have a advanced healthcare director for AHCD. As Nancy mentioned, if you were, it did happen to me once. Some of you know this. I was bringing my car in for service. I wasn't feeling well, and I hit the deck, and I woke up at San Francisco General. And if you don't have something in writing, you're not going anywhere, because everyone wants to do the right thing. So it's not a matter of Christian Science or not. They just want to make sure that you're going to be cared for. It may not be your choice of care, and that's what an AHCD ensures. Often too, even if you had the AHCD on you at the time of the incident, doesn't necessarily mean they're going to bring you directly to an Ardenwood or another Christian Science care facility. They're sometimes told you will go to the hospital. That's what the EMTs and so on are directed to do. So, but in order to get out of there, to go to an Ardenwood or a Rinke or a Christian Science care facility, you need something in writing. So anyway, very important part of the planning that we talked about in the introduction. So let's go to questions. Jim and Katie and Nancy did a great job. So here we are. We have a number of questions here. First up, we are in our late 80s and have only Part A. What would be the premium? What would the premium be added to if we added Part B? How long would Part B be recognized in a Christian Science nursing facility? Finally, when Part B is no longer applicable because of a change in level of care, what other insurance, if any, is available? A lot wrapped up in that question, but
wow. Okay, so the first one, let's just assume that somebody's 80, right? If they haven't had Part B, well, that's 15 years that they haven't had Part B. So that's 15 12-year periods. That's going to be 150% penalty. Mm-hmm. So whatever $174.70 is times 150%, that would be your monthly Part B premium. But you really have to, I always say, you have to really look at your finances, think and pray about it and decide if that's right for you. If it is, now is the time to do it, right? That's the January 1 through March 31st. But having that Part B, even like in John's talking about the ambulance or the emergency room, if you don't have that buffer where Medicare is paying 80% and you're paying 20% of a Medicare approved rate, you're going to be paying 100% of whatever they charge you, and you don't get the Medicare approved rates. So you really want to think about it and make sure it's affordable to do the Part B. right? It's really important. And Part B is not going to cover you. I think that was the last part. If I'm at Arden Wood, that's under Part A. So you would be okay there under Part A, but not Part B would not cover you in Arden Wood. And I forget what were the other parts of the question.
How long would Part B be recognized in a Christian Science nursing facility? So you just said, as we know, it's not recognized. That's for if, as I say, if you find yourself, unbeknownst to yourself at the time, that you're in a hospital setting.
So let me just jump in and just reiterate what would the benefit of adding Part B be for a Christian Scientist? We've said Part A is the only thing you need if you come to Arden Wood for a Medicare covered stay. So technically, someone does not have to have Part B at all in order to receive use their Medicare benefits at Arinki. But the two things that Jim and Katie have explained today are the benefit to having Part B, possibly for a Christian Scientist, is that it does enable you to then purchase a Medicare supplemental policy, which may be right for your financial situation. And it covers those risks that Jim elaborated on. So you can't purchase a Medicare supplemental policy unless you have Part B. So that's one reason a Christian Scientist might want it. The second one is, as we mentioned more recently, is if there ever was an emergency need where medical care was involved, then Part B would cover that emergency care up with the 20% that not covered that Jim mentioned. But so those are the two things that you would think about whether or not you want Part B. But again, it's not required and it's not needed at a Christian Science nursing facility for the basic care level.
Well said, Nancy. Thank you. Next up, I turned 65 last year, but I'm still fully employed and enrolled in my company's health plan. I expect to be employed with this company for several more years. Does it make any sense to enroll in Part A during this enrollment period, or should I just wait until I retire?
So some of the answer to that depends on the size of the employer. So if you're currently employed with an employer that has 20 or more employees, you don't need to sign up for Part A and you don't need to sign up for Part B. You can wait until you retire to do that. Right. However, if your employer has less than 20 employees, you do want to add Part A and Part B because those would be primary and the group plan would be secondary coverage.
Right. So again, right, the answer to that, right, if it's a large company, more than 20 employees, you don't have to do anything. Regardless of what your brother-in-law, neighbor, or coworker tell you, you don't have to do anything. You can just stay on that. And a lot of times now we're seeing that companies have HSA eligible plans where they're making a health savings account and HSA contribution for you, or you're making one. If you enroll for even Part A of Medicare, right, which you can do, then you cannot have any contributions into an HSA. So normally you just wait. I wouldn't go back and enroll for Part A. I would just stay on the group health plan. And then when you come off the plan, you create a special enrollment period. So there are going to be no fines. You're protected by that group health plan from being fined.
Great. Thank you. And there's another question that relates directly. Is there any situation where you don't have to sign up for Medicare at age 65 when you work for a company with under 20 employees?
No, under 20, it's just the opposite. You must, like Katie said, and we've seen that so many times where people don't enroll for A and B and they stay on, they're working for, I always say, Joe's Tire Shack, 15 employees, and you have a major claim. I guarantee you the insurance company is going to look at that and say, well, wait a sec, you're 65. How come you didn't enroll for Medicare? Because Medicare is supposed to be the primary payer. In other words, they're supposed to pay that 80%. Well, the insurance company doesn't do it out of the goodness of their heart. Trust me on that. They just do it because that's how they adjudicated the claim. They didn't realize that and they paid that. I've seen where they've come back and say, listen, we paid our 80%. No, we're not going to. You need to pay that because you should have had Medicare as your primary insurance. So I can't stress that enough. Less than 20 employees. If you're a realtor, an attorney, sole practitioner, you work for a small office, you need to have Medicare Parts A and B. If they pay a claim, you're lucky because they don't have to.
The insurance company doesn't have to.
The insurance company doesn't have to. So you really need to make sure you understand that.
And that's why we have these webinars. Jim, thank you for that. Next up, if you are a couple and one of you needs care, could the other person join them?
That would be for Nancy, like for a stay at Arden Wood, probably, was it talking about?
Oh, frequently we will have a spouse that would like to be nearer their loved one when they're receiving care. And we do, as John mentioned earlier, have these wonderful rest and study rooms that are elsewhere in the building. And sometimes a family member appreciates that, and then they can visit with their loved one for a short while during the day, whatever's appropriate, and also then have access to the Bible study library and all the resources here that support healing. So yes, they wouldn't stay in the same room as the patient where they need to receive the care, but they certainly could come visit and stay in the building in another lovely room.
And we have discounts, I think, too, when we have patients, as I recall.
We certainly do. Yes,
for
we certainly do.
Staying in the beautiful rest and study rooms. And they are beautiful rooms, friends. So please. Next up, please define skilled care at a RINKI, a religious non-medical healthcare institution. Great question.
Excellent. Yes. So skilled care means that a Christian Science journal listed nurse is providing direct supervision or actually providing the care for the patient. So this is someone who has over 3 years of training, and they've been accepted into the journal based on their credentials. So that's the person that is going to be providing the appropriate care for the patient. So that's why it's called skilled nursing. Hope that answers the question.
And some of the skilled care too, I think, is, and in terms of when it's Medicare covered, if you will, is that it would be the equivalent of an individual at a level of care that if they weren't going to a RINKI or a religious non-medical healthcare institution like an Arden would, they would be in the hospital. The care that you need is that level of expertise, if you will.
And also the RINKI care covers the equivalent of a skilled nursing facility,
right?
Which is different, of course, from inpatient. So either of those medical equivalent needs would be covered here at RINKI in terms of Medicare coverage.
Right. Question: will the slides from this presentation be available after the webinar?
Yeah.
They will.
Yeah, the replays, as was mentioned, and we opened, you'll be able to see these replays in about a day or so when Eddie is able to put them up on the web. How do you qualify to stay at Arden Wood?
Oh, that's a great question. I don't like actually having to use the word qualify. What an individual would do who is seeking Christian Science nursing care, they would call our main number, which is on our website, and ask to speak to the Director of Christian Science Nursing. Her name's Lebeche Odeni, and so the individual or the family member, whoever is calling, would have a chat with her and explain what the care needs are and why they're feeling like they'd really like to have some assistance. And so they would work together with you to determine if indeed your care need is something that our staff is ready and able to take care of for you, and just have that discussion. So and based on that conversation and any additional information that's provided, and then our availability in terms of rooms and staff, then it would proceed to setting a time for you to come in.
Great, Nancy, thank you. I have a long-term, I'm just looking at the clock. It's a couple minutes at the top, after the top of the hour. Let's just keep going. We probably have about 6 more questions, so we'll just keep going here if that's okay. I have a long-term care policy. Can I use it at Ardenwood?
Great question again. There are certain long-term care policies that we have seen that do pay at Ardenwood. For instance, one that under SHIP, Senior Health Insurance of Pennsylvania.
Right.
Yeah, plan. Oh, okay. And these were purchased probably maybe 15, 20 years ago, when they were actually issuing policies that had a rider that specified that the long-term care policy could also pay at a Christian Science nursing facility. In the last, I don't know, you tell me, Jim, like 10 years, 15 years, those policies are no longer being issued.
Right.
So depending on what policy you have, it might cover Christian Science care if it has a rider that says Christian Science nursing is the same, can be substituted for the word skilled nursing facility, and in which case that would cover you. Otherwise, if it requires that you be in a assisted living facility, we are not licensed by the state for that, and so it may not cover you here.
I think in this case,
important, Nancy, and we get a lot of those calls too on I have a long-term care plan that I bought years ago, and it's with a particular insurance company out there. Probably shouldn't mention the name, but the easiest way to do, people go, well, I have this paper that says I have a long-term, a rider on there. Is it still good? Well, you call the company. Call them and ask them. If it's not part of the contract, I don't care what the agent told you when they sold it to you. If it's not part of the contract, it's not covered. And so I think some people have been kind of shocked when they found that out. So you absolutely want to call, because you want to know ahead of time what to prepare for. That's why you buy those policies, is to take care of you. And the second thing I wanted to bring up too is most all those plans are reimbursement type plans where you have to receive care. And John, we know Ardenwood is an accredited facility, but in the eyes of long-term care insurance, they're not a licensed facility through the state of California. And therefore, a lot of those reimbursement policies don't work well at a facility like Ardenwood. You want something that's an indemnity type plan if you're going to look at purchasing one in the future, where it pays a cash benefit. That cash benefit, once you start receiving benefits, I can use those monies if I want to take a trip, if I want to have my grandkids go shopping for me, my neighbor take me to the doctor's office, if I want to pay a Christian Science nurse practitioner, I can use those monies for anything. There are no restrictions.
And you can use them at Ardenwood.
So again, absolutely, I can use those monies for whatever I want. Those are indemnity type plans. There's some out there, and those are the ones that we try and use specifically for Christian Science scientists who are interested in long-term care. The life insurance policies we talked about, most all of those have an indemnity rider. So again, you're going to receive a cash benefit and you can do whatever you want with the monies. A reimbursement plan is better than nothing, but it won't work, for example, at Ardenwood. So, but it would help you with the practical side of life. Sometimes you need to push it home, right, where you're going to have a licensed. It wouldn't pertain to a Christian Science nurse coming in, but to a home healthcare agency to come in to help with some light cooking, cleaning, maybe bathing, things like of that nature. So they're not all bad, but we just want to make sure people understand that you can't use those at Arden Wood. Right,
you,
a
Jim.
traditional reimbursement policy.
Exactly right. Next up, I have Medicare Part A. I would also like insurance plans that help pay Christian Science practitioner bills, vision, hearing, and dental care. I'm not interested in any other coverage at this time. What can you suggest?
So we do have policies that cover dental, vision, and hearing. So that is an option. You could always reach out to us on that. And then the rest of the question would be for Nancy.
Medicare Part A.
I'm sorry, I didn't hear what part I would need to respond to.
I'm not interested in any other coverage. She has Medicare Part A, but she'd also like an insurance plan that helps for vision, hearing, and
Right.
practitioner bills. So Katie just mentioned that we do have
Right.
that. So I think
On the practitioner bills is what
the
she
practitioner. Oh, thank you.
what they're
Thank you.
asking.
Right. Yeah. As far as I know, there's no particular insurance that would pay practitioner bills. That sort of just needs to be paid from our own resources.
Exactly. Do you have the AHCD or Advanced Healthcare Directive document that you can share? Yes, once again, Nancy, go ahead.
Yes, indeed. You can find that on our website, ardenwood.org. And if you scroll to the bottom of the homepage and look on the bottom left-hand side, you'll see healthcare documents. You click right on that, it'll take you right to it.
Great, and read through it. It is for the state of California, but we've sent that same document to facilities all over the United States. So it's not necessarily too state specific, but you do want to have someone look over it that would be knowledgeable in your particular state if it's not the state of California. Next up, we've got 3 more questions. I'm 72 and have had a Medicare Plan A since I signed up for Social Security at age 65. I also have a Medigap plan and hope it's Plan G. I guess the operative word is hope. I opted out of Plan B. How do I sign up for Plan B, and how much penalty will I have to pay? Again, he's 72. He got the Plan A at 65.
Right. So normally that you have to have both Part A and B to get the supplemental coverage. So I don't know how that individual fell through the cracks, but normally you have to have both A and B to get the supplemental plan.
Right.
The other thing is, it could possibly be what I see sometimes is people don't think they have Part B because it's just coming out of your Social Security each month.
Yeah.
So sometimes people forget that they even have it.
Right, that's true. Yeah.
It'd be
but
worth a
the
call
penalty-
to Jim and Katie. Yeah, excuse me.
If the penalty would be if they didn't have Part B, right, would be seven years. So that'd be 70% added on to the base premium of $175 this year. So
Great, thank you. Next up, I'm confused. I don't have Medicare Plan B, but I do have a Medigap plan. Did I use something wrong? I guess maybe this is the same individual.
Same individual.
yeah, okay, right. I don't know how that happened, but like Katie said, maybe you do have Part B and it's coming out of your Social Security and you're not aware of it. I'm not sure.
Yeah, that's worth a question, or worth a call rather,
Yes.
to Jim and Katie on that one, that particular question. What is the room rate to stay at Ardenwood overnight to visit a spouse? Nancy, I don't
If
have
someone
the-
was on the nursing floor and the spouse wanted to visit that patient, the room is $75 a night.
Wow.
It's very reasonable. The food is excellent. You would be very
Yeah.
well cared for, truly. Please.
We've seen your facility.
Yeah,
It's
it's
gorgeous.
absolutely beautiful. Yes.
And that's a special rate that we
course.
offer too, just for that particular need. Normally the rates would be $140 to $175 a night.
Exactly. It's well worth it. We try to keep the rate for our rest and study rooms attractive. People say, well, that seems low in some instances. Well,
Right, yeah.
we try to keep it at a favorable rate. You would be very pleased if you came as a guest, not necessarily even to visit a patient, but please come for rest and study. We expect to be here at least 2 more years, so please consider it. Okay, we'll have 2 questions and then we'll call it for the evening. It's does Medicare cover Christian Science practitioner treatment costs? Nancy.
No, it does not.
Right. Last question. What is the monthly premium of the Plan G supplemental plan as mentioned in the webinar?
So it's based, every state is different, right? And I gave the example for somebody turning 65 in Northern California, for example, it's about $140 a month for Plan G for a 65-year-old. If you're a 70-year-old, it may be $170, $175. But every state is different. It depends on the zip code. So somebody living in Southern California is going to pay more for that Plan G that's 65. They may be paying $160 a month, depending on your zip code and where you're located. But every state is different. We work in about 32 states right now, and we can always try and get you a rate. Even if we're not in that state, it's easy to get appointed. But it's hard to give up.
It's so hard because some states even have whether they're sex distinct rates. So male or female are different rates. Some it's the same rate whether you're 65 or 80. So
Depends.
for a rate like that, just reach out to us.
Right.
That's just a general idea in California,
Right.
but every state is so different.
Mhm. Exactly. Well, thank you, Jim, Katie, and Nancy. Once again, that was very helpful. You can see how complicated this is and why we want to, at Ardenwood, try to serve the field by having these webinars. And we're grateful for the expertise of Jim and Katie and Nancy. So please don't hesitate to call any of these 3 with Medicare or insurance-related questions at any time. They're happy to help. One other resource you are welcome to contact is the Christian Science Provider Network, which works directly with Medicare on behalf of Christian Science care facilities, as well as individual Christian Scientists. We work, as a matter of fact, closely with the Christian Science Provider Network. Another resource for financial assistance in terms of covering practitioner or care at Christian Science facilities to all Christian Scientists at all ages is the National Fund for Christian Science Nursing, or NFCSN. The contact information for these resources is listed at the end of today's webinar. Again, the point of this is that it's wise to be thinking through your options now. And before we go, I want to invite you all to our annual meeting on Sunday, May 5th at 2 p.m. Pacific. You'll receive an email invitation closer to the date. I also want to be sure that you save the date on your calendars for, wait for it, our Christmas program. We just finished the holidays. Were you thinking about that already? But anyway, save the date. It's usually the first Sunday in December, but this year it's going to be the second Sunday in December, or December 8th. The reason, if you look at your calendar, the first Sunday after is just 3 days after Thanksgiving. So the way the calendar works this year. So please save the date for December 8th. You can register for all of our online events on our website, ardenwood.org, as well as see the replays of this webinar in a couple of days and all of our previous programs. Thank you again for joining us today. We appreciated you being with us. Goodbye for now.
Bye, everybody.
Bye-bye.